Hey everyone, thanks so much for joining me. I'm so excited you could join me to talk about immune-mediated disease. And it's one of my very favorite things to treat. I know a lot of people don't like treating it, so I thought maybe I would share with you the little bits of stuff I learned over the last 20 years working with it. This is part one, early recognition and prevention. And I just wanted to reiterate that when you work with preventative protocol with these guys, you can just really cure them a lot of times without any further medications or treatments. So anyway, I'm Donna Kelleher, and I have been working for 20 years, over 20 years, as a holistic veterinarian. And I work in Washington State. And let's see, I'm certified in acupuncture, chiropractic, NATE, and I'm also a master herbalist. But if anybody out there is an herbalist, they know you're always learning when you're an herbalist. This is a picture of me, of Maud and I at the clinic. And Maud is now 17 and a half, and she's been treated. She was treated when she was 2 or 3 for an immune-mediated issue just called IBD, inflammatory bowel disease. And she was cured back then, and now she's 17. And I guess it's just a reminder that these animals can be cured and not medicated or suppressed like Western medicine tends to do. So holistic medicine is just a great tool. So I'm going to share with you what I know about it. Thanks so much for joining me. Couple things here. Well, the picture on the left is a gal in, Jeff and I went to Delhi, India, and we spent a little time at a veterinary clinic there. So that was just a picture there. It was such a beautiful picture, but just showing how people love their animals everywhere. One little side note is in India there were no cases of immune-mediated disease, and we'll get to why that would be in a few minutes. But this is kind of a dry subject, so I thought I'd have Gizmo kind of help us spice it up. This dog on the right is a dog I've been treating for a few years for vestibular disease, which isn't considered immune-mediated. However, no one knows what causes it, so perhaps it is. Chinese medicine sees it as a trapped liver wound, but here's little Gizmo.
On legs. Maybe it's just, that's pretty good. Does he do this at home?
Yeah.
Oh.
He does it wherever he goes. For anyone who has a cookie. He's very demanding. Yeah.
I just love Gizmo. So, and that's the one thing about Gizmo. He's 16. So most of the dogs that come to me are pretty getting up there. It's just so awesome because they live to long ages. A lot of elderly kind of dogs is because they haven't had any Western medicine, very little at all, if any. And so it makes a big difference as far as longevity goes. And there are places for Western medicine, but when it comes to chronic suppression of symptoms like in immune-mediated disease, herbal medicine and holistic medicine is just, I think, so much better if you can catch it early enough. So let's talk about immune-mediated disease or autoimmune disease. Now, they're not exactly the same, those two things. Autoimmune disease really does mean that you are attacking your own cells, whereas immune-mediated could mean that your immune system's confused but not necessarily attacking itself. So kind of a little different but similar overlap. It occurs when the immune system mistakenly attacks part of the body instead of the foreign antigen, like a virus or bacteria. And it is common in purebred dogs, but can occur in any breed. And it's true, many cases of lupus, like the one I'll present soon here, they're in mutt dogs, usually over-vaccinated mutt dogs. But it's true that German Shepherds, Cocker Spaniels, Giant and Mini Schnauzers are really commonly afflicted with immune-mediated diseases. I hope you'll understand in this presentation that the main thing to come away is that early symptoms, like this is Wilson, a little beagle with a belly that's inflamed, and he's got a skin issue, but we got that under control with just 3 visits, and now I don't see him anymore. But I guess that's the thing, is like, is that an ounce of prevention or is worth a pound of cure? I think that's the saying, and I think it's really true. So, by catching chronic skin issues early, chronic inflammatory issues early, we're able to prevent immune-mediated issues later in life, especially if it's a breed like a German Shepherd where you're pretty sure that there's a good chance he could develop immune-mediated disease. And this dog Wilson, he's not even a year old, so but this I have not seen Wilson in over a year, and I know we cured him up, so it's a wonderful thing to go to holistic medicine if you can, a holistic veterinarian. There's a website, ahvma.org, where you can find holistic vets all around the world, I think, definitely around the country. But anyway, early symptoms of immune-mediated disease. Most of the time, people say when they were younger, yes, they were itchy. They had some bouts of diarrhea they couldn't explain. They got ear infections pretty easily, skin infections. They had maybe reverse sneezing or allergic respiratory issues. And urinary tract infection like vaginitis, which is usually treated antibiotics, and sometimes the immune-mediated disease is just kind of starting to flare up there with the liver. And fevers. Fevers come along with many of these immune-mediated diseases, and they're usually quite high fevers, 104, 105. A dog's normal temperature is 100 to 101. A cat could be 101 to 102, but so yeah, some early symptoms. So I didn't want to get lost in the jargon here, but I did want to present these sort of diseases because it's super critical just to kind of know what they are. And they're all kind of interesting if you look at them as a group and not all the harm and pain they cause people. But it's interesting to note that in humans they have described over 70 types of immune-mediated diseases. 70. 70. So that's a large number. And in dogs, it's probably not that high, but it seems like all the time, a lot of these things are becoming almost epidemic. And we'll talk about some potential causes here in a second. But my main thing is I just want to describe what these were. So leukoid onchodystrophy, this is sloughing claw disease. This is when their dogs attack their claw, their nail beds. And at first, I'll show you a case here in a minute, but at first there's just the claw kind of disappears, the quick is exposed, and you think that's weird. Maybe my dog got his foot caught somewhere, or there's a little infection or something, and then pretty soon the body will slough that claw, and I'll show you that here in a second. Canine cutaneous vasculitis, that's the case I'm going to present next, and that's where they attack the vessels along the tip of their ears, or in this case, the dog got some vasculitis along the top of his pads and his paws. But usually it's the tip of the ears on this one. Systemic or discoid lupus. I have a case here where the discoid lupus, which starts at the nose, went systemic, or at least partially systemic, in a dog named Ringo. So we'll talk about that here in a second. Glomerulonephritis, that's a kidney issue, and now we're realizing that a lot of these sort of chronic kidney disease, both in cats and in dogs, have immune-mediated aspects to them, where there's a type 3 hypersensitivity, and these big immune antigen complexes go around and sort of plug up the nephrons in the kidneys. Hypothyroid and hyperthyroid used to be almost non-existent, and now in humans also is an epidemic here, and there's a numerous causes for that I think we can look at. And but just to know they're very treatable in holistic medicine. Immune-mediated hemolytic anemia or thrombocytopenia is where the dog attacks his own red blood cells or platelets, and it's quite a serious situation because most of the time you don't know what's going on until it's really pretty bad, like the case I'm going to present. Perianal fistula is pretty much just in German Shepherds. Never heard of it or seen it in any other breed, and very common. Unfortunately, a very, very difficult autoimmune disease. Masseter muscle myositis, MMM. Crazy name, but it affects all different breeds, and it is where they can't open or shut their mouth. They're attacking the muscles around their masseter muscles. And so it's kind of a serious thing, causes some pain, and very treatable with holistic medicine. Many of those types of cases are stabilized with steroids, and then we have to come in later and reduce the steroids and replace them with herbs and acupuncture. Degenerative myelopathy, very difficult case. It's like MS in people where they demyelinate around their nerve sheaths. And that presents a difficult situation with acupuncture, which requires the myelin sheath to really work. but we'll talk about other treatments for that. And immune-mediated polyarthritis, very treatable with acupuncture, and in young dogs that have just been vaccinated generally. Pemphigus, there's 3 different types of pemphigus in dogs, just say pemphigus in general, and where they attack their own skin. It's kind of one of the layers of the skin gets targeted. And granulomatous meningeal encephalitis, this is GME, I forgot to say that here. GME is, I believe, and I'm the only one that I've ever heard say it's definitely immune-mediated. Maybe other people suspect it, but I've had 3 cases, and all 3 cases have been completely cured, where I do not have to see them anymore, even though they had previous blindness and seizures. Very serious disease. Unfortunately, if you look at Dr. Google on that guy, GME in dogs, it says it's always fatal, and that's just not true. So moving on. So I just wanted, if you guys are dealing with immune-mediated disease, I think this story is going to ring true for you. And this is one of my clients, Andrea, and her dog Tucker.
He had just recovered from parvo, and he also, before getting parvo, had been from a bad situation where he had almost starved to death. So he was very not in a good place because he had recovered from that. Then he had gotten parvo. I mean, he was good, except he then got vaccinated and neutered, all on the same day.
Oh boy.
So I think he probably would have been okay.
Yeah.
But the combination of being, vaccinated with the neutering, he seemed fine at first, but not too much longer later he got vasculitis. So as you can see, his ear tips are kind of notched.
Yep.
Because they were, cracking and bleeding and not doing well. It took a really long time to get him better. We went to a dermatologist who kind of got him on the path to getting better with pentoxifylline and atopica.
Oh, okay.
But we didn't know any better at the time, and we just wanted to get him better. So what that, I think, caused was behavioral problems. So he kind of was edgy, I think.
Right,
so he snippy, really kind of...
you almost can't blame him.
Yeah. So that's
kind of what's been going on with him. Yeah.
Also, he got mange. So when we first
boy.
got him, so he kind of, his immune system was a mess. So
you had Demodex mange.
Yeah.
Hey Jeff, you videoing this?
Yeah.
And
I'm the videographer. Usually I'm not on the video, so now my voice is on the video too. So this is
that's good.
This is gonna be a
That's
different kind of video.
We need different. Everything's been the same,
Wow. So he's had quite the history then.
Yeah. So he had a rough start.
Okay.
Then we got in touch with Donna. We got him off the atopica, off the pentoxifylline. His ears got better. Then his feet, he got sores, vasculitis sores on his feet, along the margins of the pad.
Right.
So
it moved from the ears to the feet, and we were like, "Good, it's not in the ears."
And then it healed, and then it went back to the ears.
Oh.
So
It's like, oh no.
we've kind of had off and on with the ears.
Right.
We're waiting for the spring because that's usually when it's the worst.
Oh, sure.
And we're hoping that he seems really good right now. He just had how long? Maybe 2 or 3 months of staph.
Oh boy.
The little circles.
Yeah.
And kind of just he had a yeast problem too in his armpit.
Yeah.
Okay.
So Donna got him on the skin herbs, and we finally are better with that. But he's kind of been a process, and I also feel like, yay, he's healthy, and now I'm kind of like, okay, what's next? I mean, I hope that's not the case, but this is Tucker. So I'm hoping though that we're truly, truly, truly on the.
So that's Tucker. He's kind of an amazing case, really, because he had so many aspects of immune-mediated disease. So we'll go through his case real quick right here. Just to let you know, though, he's been about 10 months with no symptoms, and but it's been a lot of work for these guys. They have him on an anti-inflammatory diet. That's just meat, vegetables, a few supplements that he doesn't react to, like calcium and herbs and some omegas, not fish oil. He reacts to fish oil. But I wanted to show you some of the lesions that he had here. So the cytokines were directed into the inside of the certain blood vessels, along his ear tips. And this, of course, this immune-mediated disease, it does involve different types of white blood cells. There's an irreversible ischemia. So you can see here, there is a notched way that his ears are, and they're never going to come back. So whatever we lose on the ear tip, we stay lost. But what holistic medicine does, and it's so cool, is that it can, and then of course this dog was really bad. He would just shake his head and blood would go all over the house. And really, before I met him, I think that happened for weeks or months, even while he was on all these medications. So it was a bad case. Anyway, but what it is with herbal medicine, just topically, if we just talk about that, we can use salves that fight the fungal infection, fight the fungal infection that will set in here when the vasculitis really flares up and the tissues die. If the ears are hot at the end, like in this case, Tucker has a lot of heat there, then we might use supplement or salve, like a plantain salve that might be cooling and just kind of soothe the area and heal up the tissues really fast. So if it can heal really fast, it can prevent further ischemia and further loss. Here's some other pictures. So this is Tucker when they called this the snoot. They used to get these snoots made for him so that if he shook his head, blood wouldn't like go all over their really nice house. But this is also a picture of his foot vasculitis, which was less common, but we knew it was just a matter of where the lesions had moved. And in holistic medicine, you're always happy when lesions move, because I always think of it like I have the lesions on the run. I have the symptoms on the run. They're trying to figure out, they had to move because it didn't feel so good to be in one spot, and now they moved to another spot. So anyway, Tucker's been 10 months now with no symptoms. So what are the 4 synergistic causes of immune-mediated disease? Genetic predisposition. These are almost always purebred dogs. Vaccination or over-vaccination. We've been able to actually induce immune-mediated disease in breeds of dogs, a group of cockers, with over-vaccination. Poor nutrition, and so to me, that's pretty much every kibble-based diet. I'm sorry to say, even the good ones are not ideal in the way of immune-mediated disease loves heat foods. Heating foods are always carbohydrate-rich foods. And even the high-protein, low-carb kibbles are still carbohydrate-rich compared to an anti-inflammatory diet. Lack of antioxidants. So there is an amazing book that I would love you guys to all read, and then maybe email me, give me your feedback. Epigenetic Revolution. Okay, she gets a little cumbersome because she's a scientist, Nessa Carey. But it will explain why my dad has asthma, and even though I was born with asthma and almost died of it when I was 2, now I don't have it. So how could that be? How could that be that I've modified my genes in that, and how I've done that is through epigenetics. And it's very possible that epigenetics are more important for disease sort of resolution and symptomology than genetics. So really amazing sort of science that's supporting holistic medicine here. Chemicals, our world is full of them. Even if you think that you live organically, like we live off-grid, we've never had any chemicals well, we don't live off-grid entirely, but we live out in the country. We don't use any chemicals. We have no Roundup. We've never used any chemicals anywhere, but we are still infiltrated with chemicals. As much as we try to not be. But our livers can keep up with that to a certain extent. But at some point, especially if there's a lot of chemical use, the dogs, their feet, chemicals go right through their feet. Rosemary Gladstar says, whatever you put on your skin is something you would want to eat. So just think about that. Anything you put on your skin or your dog's skin is something that should be safe for him to ingest orally. It's really important to think about what we're doing to their skin. Anyway, so what are the cells and immune-mediated mediators that are involved? So we've got 3 arms of the immune system here, and all of them are somewhat involved. The second one is the most important one, but the first one is the white blood cells, the neutrophils, the basophils, the eosinophils. The eosinophils are the allergic type of cell, white blood cell in the body. cell-mediated immunity, that's where most of our immediate antiviral or antibacterial type of reactions and also autoimmune reactions happen at the cytokine level, histamine level, or the prostaglandin level. So that's where, in conventional medicine, Apoquil is a new drug which stops the cytokine. It's a kinase inhibitor, and it stops that pathway. But my experience is that a lot of times with these severe immune-mediated diseases, the body just figures out a different way to go around it. Bodies are the best holistic cases are often sort of where the Western medicine hasn't worked. So humoral immunity, that's long-term immunity, and that involves the antibodies. But we'll just focus mostly on the cell-mediated immunity when we talk about this type of stuff. And I'm going to try not to work on the jargon. It's hard though, but I'm going to do my best. So this is a Ringo. He's a mixed breed dog, but you can see there's redness around his eyes. This is discoid lupus. See this red spot above his nose, and it gets all the way back to where the white is too. So this is where the cells react to the DNA of slough cells, so on the basal cell layer of the skin. And in systemic lupus, the reaction is not confined to the skin, but in discoid lupus it is. So this dog started getting joint involvement here, where you could even see that his elbows were really puffy at one point. But in general, lupus goes to the kidneys, heart, and joints. And lupus, just like all immune-mediated diseases, does respond to herbs, acupuncture, and diet. And so that's how we basically cured this dog Ringo as best as we could. He still has a little bit going on, but that's only because he lives on a chicken farm and he's allergic to chickens. What are the chances? The egg white allergies are usually related to vaccinations, and we'll talk about that in a second. But he was also allergic to grasses, trees, and of course he lived on a farm. But I don't know if you can see this here, but around his eye margin, it's less red, and his nose is better too. It's hard to see, but this was about a month after we started treating him. He responded pretty quickly to the acupuncture, actually. Okay, so what do we do with Ringo? What do I do with really any immune-mediated case? I gotta find the triggers. What are the triggers into this immune-mediated disease? Nate has been my little tool test here, and it's the reason it's controversial, you look online, it's like, yeah, people go like 100 times or something. I mean, I basically would never get that kind of compliance. I think that, and I wouldn't want it anyway, I'm trying to look to control these symptoms by 6 treatments. So if I don't get it by then, I'm kind of, talking about maybe not keep going. But anyway, so that's why it's controversial. But otherwise, it's completely amazing. And it's just one of these types of energy techniques. There's numerous ones that work similarly, but this is just the one I know. So you use muscle testing to figure out what the trigger is. So to isolate and clear each trigger. I say, well, I'll be lost without it, because without clearing the triggers, my herbs wouldn't work as well. They just wouldn't be as strong or potent, because the body is all the time fighting like the diet or fighting grass and I am just basically trying to, thumb around in a dike that's about ready to burst on me here. So it's really, put my thumb in there. It's not going to work. So I use the Nate. Nate uses a combination of chiropractic and acupuncture or acupressure to clear each allergen. So, and that is a pretty powerful tool, especially where it's things like grass or weeds where you can't really avoid them for the whole dog's life. So I have found Nate to be much more successful than blood or saliva tests, because the main thing is that these allergies change, they shift. Tucker was a dog who really showed me he would start to react to a new protein in 6 days when he was really bad. It meant like he would, on day 1 you're feeding him venison, he seems pretty good. On day 6 he gets a lesion, and it's like, well, okay. You figure out, wow, he just reacted to that venison. Well, the only way I could figure that out is through muscle testing. Originally, and now he can be on a protein for 2 weeks. It's like this big. So they have to buy a lot of novel proteins for him, and we have a raw food co-op where they can access those things pretty easily here in Seattle. So anyway, immune-mediated diseases, just a side note, they're not common in the third world. We took this picture when we went to the Delhi shelter. But basically, yes, we can adopt an Indian dog, and we can pretty well sure he's not going to he might have Demodex for a while, or, well, most likely sarcoptic mange, but he's not going to have immune-mediated disease, most likely. So our modern hygienic practices have led to an epidemic number of human cases of immune-mediated diseases. And that's because it sounds gross, but it's these worms. So hookworms and pinworms, and I don't know about pinworms, but hookworms and whipworms especially hookworms, are helminths. Nobody wants to say worms, so they're going to say helminths. So now there's a whole thing where if you have an autoimmune disease, it's really serious and severe, you can buy hookworms online to help cure you of it. Crazy thing is, they've actually recreated that in mice, where some of these immune diseases are cured with worms. Like, go figure. What's that worm doing? Is it redirecting the immune system, or is it putting out a chemical that's somehow helping? And I don't know that we really know yet, but something to really realize. So I was going to go into a couple of cases here, and didn't want to get boring here, but I just wanted to show you just a few things of what I'm going to, again, focus on treatment more in part 2, really focus on it. But I treat sloughing claw disease, I think, pretty successfully. Lately here, it's been taking a lot less time to sort of get them controlled and cured, but in the beginning it was harder. It kind of depends on the cases. Nail bed disease is another way but common in greyhounds and black-nailed dogs. So I've had numerous cases of giant schnauzers. I also have a Rottweiler that came in a few months ago with it. It starts with nails that split too easily, related to the liver in Chinese medicine. The liver is manifested in the nails and hair coat. It can be very painful, and these dogs can limp, and it's very, it's difficult to watch for sure if you don't have if you're not armed with some good herbs for pain and things. But it's great to have a holistic vet involved. Conventionally, it's treated with doxycycline, and sometimes that works, or at least works for a while, but a lot of times, like with this Rottweiler, suddenly, that didn't work, then they had to go to the next type of antibiotic, and that didn't work, and they just keep adding on drugs. So this dog was on all these drugs, and now we've got him off of it, and it's just really nice. The people get so happy. Much rather give them herbs and things with no side effects. So very responsive to probiotic therapy, and that's because there's usually a history of immune disease, so there's always food triggers with this particular syndrome. Chicken is a big one, beef is a big one, of course, grains, but I also have an allergy to fish oil. Fish and fish oil are the same in holistic medicine, the way I look at it from food allergy standpoint. So don't keep giving these guys more fish oil. Maybe try no oils for a while, or a plant-based oil, like maybe hemp oil, if you want to try that. But so I thought I'd spend a few minutes to talk about probiotics and prebiotics, because boy, I just can't say enough about it. Whatever we eat, if we change our diet within just a few days, our bacterial flora completely changes. So these are the types of organisms that we're looking at: Lactobacillus acidophilus, Bifidobacterium, Enterococcus, and I try to put down, the different products that had these, that focused on these different bacteria. Prebiotics, inulin is the most common one people use, but burdock root's a great prebiotic, and there's a number of herbs that work like this too, but burdock root's the one that comes to mind. It's also considered an alterative herb. So it cleans your lymphatics and feeds the bacteria in the intestine tract. So it's so smart of the Japanese to pickle gobo root. That's what burdock root is in Japan. But Bastier did a study on probiotics and basically said, most of them aren't what the bottle says it is. They only actually found 2 out of 52 that were what they thought. And they actually, Mercola released his findings too, which were basically 1 teaspoon of sauerkraut and you're pretty good to go. And actually in dogs, sauerkraut's a great probiotic, especially for the cases where they're just reacting to everything. So they'll react to yogurt or even goat's yogurt if you give it to them. And so sauerkraut's just kind of a fallback. It doesn't work as well as some of the probiotics like Metagenics or RX vitamins or even Fortiflora, Purina's for Fortiflora with Enterococcus. It was like Purina doesn't really do much right, but they did that one pretty well. And I wonder sometimes, though, if it's the selenium, zinc, and vitamin E in there that really help the dogs feel better. So just another slide talking about probiotics. I know we don't want to talk about jargon here, but there's this toll-like receptor, they call it. It's kind of weird that they call it that. Why? Is it like the New Jersey Turnpike with the tolls? I have no idea. But TRR4. What they found was when dogs have this receptor, they're really prone to immune disease. And how can you stimulate it or not stimulate it? Really, the gut flora is a big part of that. So this receptor is stimulated by the gram-negative bacteria. So gram-negative bacteria tends to be your pathologic bacteria, like your E. coli's. That's not always true. There's some E. coli's that are beneficial too, to believe it or not, but most of them, or your I can't think of the name of the other bacteria. I will, and I'm not thinking about it. Anyway, so most of them are, but the probiotics are usually, I think they're all gram-positive. There's one E. coli that's considered beneficial, but otherwise they're all gram-positive. That's a good thing to realize. So it's really been experimentally reproduced that we know this now. Immune-mediated anemia and thrombocytopenia. This is a dog named Douglas who basically had such bad petechia and ecchymosis on his belly, and we already knew he had almost no platelets. And I was sort of involved with the case, but anyway, he was treated with steroids and such too. But at any rate, if you see anything like this on the skin, it needs to go to the doctor. You don't try and treat anything like this at home. This is a severe situation. He could have easily bleeded into his abdomen and things. So, but I just wanted to say anemia causes low energy and a pale tongue. Sometimes you can see it ahead of time, and the low platelets, it's really hard to see that ahead of time. But sometimes you'll see a little bruising on the skin, just not like this, but just like a couple of spots. And you'll be like, okay, I better go in and get a platelet check. Platelet counts are notorious for being off, so you have to make sure you reiterate to the veterinarian that you're interested in a platelet count, and can they, draw up the appropriate tubes to make sure that's to make sure that's an accurate count. Platelets like to aggregate and like kind of stick together, so their count is sometimes off, but. Anyway, so we used with Douglas, and we used Nate and diet, and the main thing I want to say is there's herbs that build the blood. They work actually on the blood. They work on the blood bone marrow to build the blood, and that is so awesome that we have herbs that can do that. So ashwagandha is the one that really comes to mind, but so does yellow dock. Those two herbs are really useful here, and I would talk more about this in part 2. So here's another one, pemphigus. Sometimes, with Bella here, I mean, she lived to 16. It was amazing. But sometimes we had to use, we used 1.25 milligrams of a steroid if she got really bad. It was such a tiny dose, but it was able to keep her from getting like cushingoid symptoms or side effects. So, but it was enough to sort of stabilize sometimes if she got really bad. So this dog loved bread, and so did the person. So, the bread is really bad for immune disease. Crackers, bread, cookies, dog treats. And she would just get it like almost every week. I don't know how. It was terrible, really. But there's always blood heat present. You could almost smell this dog coming in. She smelled like she was sort of burning up. And so we used foods to cool. So what foods cool if she's not allergic? A food like cooked pork, or the classic is like cucumber. Think of cucumber as cooling, and herbs to cool the body, but also and improve the adrenal function. So that would have been like Schisandra or things like that. It was a great case because we could help prevent these secondary infections in the skin, and so keep her off antibiotics as much as we could. And let's see, is there anything else with her? I don't think so. She's a good girl. Degenerative myelopathy, that's a more frustrating one. Well, they're all, this bemphagus isn't not frustrating, but degenerative myelopathy is frustrating for me, being primarily an acupuncturist, because of the problem with the myelin sheath. I mentioned earlier that acupuncture really does require that myelin sheath to work. But here it says common in German Shepherds and Welsh Corgis. So I'm going to show you 2 videos of a Welsh Corgi, this one and one other. And Corgis seem to get DM in a really severe way. You know, it progresses fast. It seems like the Shepherds, it seems like it's stabilized. Well, in both cases, you can stabilize it a little bit. Dr. Clemens has done a lot of antioxidant protocol research, and he was at Florida University, that school there. And basically, I also added to his protocol the glutathione, the N-acetylcysteine, the B vitamins, and immune modulating herbs. And those herbs are usually, like, a lot of times the medicinal mushrooms, that type of thing. Reishi, Ganoderma, and also maitake. But acupuncture, if it's in the early stages, it can help sort of offset this. But the thing is, what happens is these cases look just like chronic disc disease, and that's very treatable with acupuncture, or other spinal conditions. Spinal conditions are one of the main things we treat with acupuncture. It's just that if it's a DM case, then they just don't respond like the other ones do. It's so kind of sad. But anyway, here's what it looks like. And we video it. Captain, can you do some tight circles? Maybe? No?
Yeah, that's
Kind of he goes for the rugs more.
well, I think his traction's better on the rugs.
I know. Hey, Jeff. I just wanted you to look at this knee before I did anything.
See how she goes
That's-
sideways?
It's spinal. Isn't it? Neurologic?
But you'll see, and then as soon as you get in there on the other floor, you'll see
It's
how
worse.
much worse it gets.
Hey, Katie, can you walk?
Come here, Katie. Come on. Katie.
So she didn't have any symptoms. Okay, so those are just 2 cases of, I wanted to sort of point out that first the dog is twisted to one side, and that's because, you know, you have more demyelination on one side than the other. And that case came to me, they thought it was a knee case, and it ended up being a spinal case. So, and I guess that's the one thing about DM, it's really hard to diagnose. You technically need a nerve biopsy to diagnose it, which no one does. So basically, I've had a number of cases where they were diagnosed with DM and they really weren't DM because they responded like very fast within 3 treatments. And I knew that they must be actual disc disease cases. The thing is, their spines on the x-rays don't look normal either. So, but you can't see an MRI change with DM. It's demyelinating, so it's really microscopic almost. Okay, so let's go to the next one. We're moving from one fun case to the next. Perianal fistula disease is almost always a German Shepherd thing, and the sebaceous glands around the anus are attacked, and then they abscess and open into fissures or bleeding fissures. If it's caught early, it can really be helped. This one especially can be helped. And then the lip folds are, I have a picture of that here in a second. This is what it looks like. You basically lift the tail of these poor German Shepherds and you see hamburger meat. It's just awful. But in herbal medicine, what we're looking here at is that, and yeah, these always have food triggers: grain, chicken, beef. Those are very common. But sometimes it can be a weird trigger like minerals, you know, and it really helps to have innate understanding or a allergy understanding, so you can clear those minerals with a treatment. But anyway, herbs that work on the glandular pathways. And then the other thing that when you look at the lesion like this, you think it's weepy, it's wet. And in herbal medicine, we're thinking about astringents. What can dry that? Witch hazel is the classic astringent, but maybe oak bark used internally to dry that. And just, it's so weepy. Here's what the lips look like. This is an early case. of what I knew was going to maybe progress into fistula disease around the anus, but hadn't yet. So we really got a jump on it, and it never. If you get a jump on it, you can prevent those perianal fistulas from happening, I think. So. Again, we use topical herbs. We use internal immune modulating mushrooms. We use a little Oregon grape for this one for secondary infection and for the liver, to strengthen the liver. Immune-mediated polyarthritis, that one's very treatable with acupuncture. And so I have just found that to be extremely helpful, more than anything, even more than the herbs. But basically there's hock joint, carpus, and elbow. Those all get inflamed 4 to 6 weeks, maybe even 2 weeks after a vaccination, real young dogs. So here's my little kind of cheat sheet list, and this is just according to me, it's not, I've never seen this anywhere, but this is true that DM, perianal fistulas, and anemia and thrombocytopenia, those are really difficult to treat. You're working with trying to get them off conventional medicine or reduced conventional medicine, or even just working side by side with conventional medicine. And then responsive to therapy. Yeah, that polyarthritis is nice. Inflammatory bowel disease, I've probably had 100 cases, or I don't even know. And they all respond beautifully. You get different types of therapies, though, and you almost always have to figure out what the food triggers are. Sloughing nail disease and vasculitis. What's the vaccinosis protocol? So basically there's a syndrome called vaccinosis where you get a vaccine, then all of a sudden your liver gets inflamed, your skin gets lesions on it. Anyway, this is common in dogs, at least, that have had numerous vaccines, like through big box vet stores that push a lot of vaccines. And the big thing to realize here is that lepto and bordetella, those are both considered bacterial infections. They're not as good in terms of how well they work as a vaccine. Both vaccines maybe might get you a 3-month immunity for your dog, maybe not, not at 100%. And then they're inflicted a lot with these immune-mediated diseases after getting those vaccines. So please just be educated about those. You can look at Ronald Schultz, his recommendations about those, as he always is sort of against doing. These are not considered core vaccines. These are ones that the vets push for various fear-related reasons. But it's important to do some vaccines. We're seeing a growing amount of distemper in Seattle, and it's because people are going, okay, I get it, vaccines are bad. And it's not that way. It's just it's not like vaccines are bad. It's just that maybe 1 or 2, 3 in their lifetime, and maybe doing rabies, that's it. That's all you want to really do. But the problem is these dogs, they get so many, especially when they come through rescue. They're getting tons of vaccines there. So in holistic terms, what we do Thuja occidentalis homeopathically, 1 or 2 pellets, and just given once a night for 7 nights, and just to kind of clear those vaccines out. And then on an empty stomach, and then the alterative herbs like burdock and yellow dock and blessed thistle are amazing to help the liver and the skin sort of rebound from any vaccinosis type syndrome. And then there's a product that my friend Erin Zamzo sells called Vivo ZeoClear. She has a company called Vivo, and this product has a lot of these types of alterative herbs, plus some clay and other ZeoClear to help pull the toxins out of the body. So that's a really cool product to use short term too. And other preventative tips. Let's see, identifying food triggers. And, that's the biggest thing I want you to take away, is that there's food triggers, there's environmental sometimes triggers, and identifying them and keeping to one protein at a time. It's called novel protein switching. So basically it takes 2 weeks to start mounting the humoral response, but so the long-term response of the antibodies. And so what we do is we try to switch the proteins and stay ahead of the immune-mediated disease and the reaction. A lot of times the food is perfect, but people are giving treats, and the treats are a problem, and the proteins don't line up. So we just basically, an anti-inflammatory diet is just protein and vegetables. And we do a lot with detoxification with the ground greens. So parsley and cilantro, those are always good. Cilantro, there was a study the American Chemical Society did on cilantro, basically saying that it is the best thing to help with heavy metal toxins, to pull out heavy metals, even just out of water. So they were actually thinking about using cilantro in water systems, like in Southeast Asia, where there's a lot of heavy metals. So that was kind of interesting. I mean, it could be done here in America. We've got lead and such. So but it also pulls it from the body, heavy metals from the body and toxins from the body. Broccoli, fresh burdock root, we've talked about that a lot. Get that in bulk at the health food store, especially in the fall. And kale, I like that black kale, the lacticino kale, the dinosaur kale. Antioxidants do so much for the body. Of course, vitamin A, you can overdo it on A, you can overdo it on D, and you can overdo it on E. And that's because at least A and E are fat-soluble vitamins. That is to say that the body will store them, and the liver can get a little bogged down. I had a little dog that got an immune disease because one of the triggers was vitamin A, and she was having a tablespoon of cod liver oil once a day. And that's good for cancer prevention, but just a few drops or every other day, she was getting a huge dose. But vitamin C in bioflavonoids, these are water soluble a lot of times, so the body will just pee out excesses. For degenerative myelopathy, we were talking about, or anything that affects the nerves, we're talking about B vitamins and calcium, as those are really essential for the nervous system. And then the vaccinosis protocol. And we can go back to that slide, I think, for a second. Vaccinosis protocol, just so you can remember that we like to use Thuja occidentalis. It's a homeopathic that we use to help, like say, clear the vaccines, but you still get the benefit of the vaccines. You just don't get so much. The body can let go of it. Let go of any. There's something in holistic medicine called a miasm. I'm not sure if you guys know what a miasm is, but a miasm is where in homeopathic terms, there's actual genetic weakness that's caused by not only vaccines but chemicals that the body is exposed to. And we're not just talking about the body that is in front of us. We're talking about the genetic body, right? So we're talking about the parents, the grandparents, So this is called a miasm. And this kind of explains why there's breeders out there with German Shepherds, and yeah, they don't vaccinate. Yeah, they feed raw. They do all this stuff, in quotes we say right, but they still get immune disease in their lines, and it's because of the miasms. There were so many genetic breaches early on, or genetic weaknesses early on, and those are really difficult to overcome. And we can use things like with epigenetics. We know good diet, we know good lifestyle choices can help alter those genes a little bit, or what genes get transcribed into proteins, but you can't entirely alter them. So you can't erase them. So miasm really speaks to the genetic weakness that is caused by previous lines of vaccinations within the genetics of this particular animal. So, but Thuja helps prevent that miasm. It helps prevent the way the body can restore. There's also another thing called retained pathogens. And in retained pathogens, you're basically, that's what a vaccine is. You're basically injecting the pathogen into the body, and I guess you're kind of hoping that the body can then just store the antibodies and then recover from that basically insult. But not everybody can do that appropriately. So, and we see here with immune disease and it's linked to vaccinations that retained pathogens and the whole miasm weakness, genetic weakness, can really be at the base of it. But still, do I recommend vaccines? Yes, I do, for young animals and animals that are at risk. So it's not an all bad or all good type of scenario. I wish people could actually have a dialogue like that, so it's not, so people don't do anything reactionary. We tend to not think, we tend to just react. So Oh, I forgot to say that the nutraceuticals like quercetin and bromelain help stabilize the mast cells. Yeah, stabilize the mast cells. So mast cells release histamine, right? And that's one of our other, in addition to cytokines, that's one of our other immune mediators. Um, yeah, most of these guys, I tell people if you guys can get your pets to come in, if you guys can come in maybe once every 3 months, just so we can check in and make sure there's no little red flags kind of coming up, either in the blood work or in the with the patient's symptoms, then I think it's a really helpful tool to use a little acupuncture and just an ounce of prevention. On some of these guys, it really makes a big difference, and catching things early. So anyway, I hope you guys stick around for the question and answer side of things, because I have plenty of time, and my goal is to, if there's a question out there, I want to answer it. So please, and then if you have any feedback at all, any criticism, anything like that, I'm happy to get that and try to alter how I do things in the future, because we really want to use these as a tool, these webinars as a tool, to help train people, to help get the word out about some of these triggers and some of these preventative things. We want to try to cut down on the epidemic number of immune-mediated diseases that we are seeing as veterinarians. So maybe you can help us do that and share all the information, and we'll probably end up trying to do this again, especially with your feedback. So thanks so much, guys, and I'll stick around here for any questions that you might have.